Thank you, judges. My next topic is new Vitreo challenges in eyes with permanent keratosis, a 7-year study. None of us have any financial interest regarding this subject. In eyes with keratopathic eyes, several common obstacles like obtaining adequate surgical exposure, visualization, and hemostasis were noted for last decades. And vitreoretinal complication, eyes with permanent keratopathy, one was noted at retroprosthetic membrane, RPM, retinal detachment, epiretinal membrane, vitreous opacity debris, and endophthalmitis. Eyes with permanent keratopathy present unique challenges for posterior segment surgery. Managing vitreoretina through the small optical cylinder is also a real obstacle. So our purpose of the study is to assess the vitreoretinal complication outcomes of an intra and postoperative challenging factors after implantation of permanent keratopathy. It was a retrospective review of 102 cases of permanent keratopathy implanted by single anterior segment surgeon over 7 years time period from 2010 to 2016, and posterior segment complications were managed by a single surgeon at the same institution, where in all 23 gauge vitrectomy done along with associated procedures, and silicone oil injection 5000 centistroke injection done only in eyes with retinal detachment with or without PVR and persistent hypertonic cases. Challenging factors, intra and post-op factors identified were difficulty in visualization, difficulty in vitreous base excision, recurrent intraoperative hypertony, intraoperative bleed, and postoperative chronic hypertony, that is hypertony persistent for more than 1 month duration. Total number of permanent keratopathy done in last 7 years, 102, out of which 86 were Boston keratopathy, 16 were Oro keratopathy. Out of 102 cases, 12 interventions done in 10 eyes who developed vitreoretinal problems after a mean period of 10.33 plus minus standard deviation in months. Mean post-op VCBA improved to 0.95 plus minus standard deviation in logMAR. This is the clinical table showing the clinical characteristic and challenging factors. Primary retinal detachment, recombination retinal detachment with PVR noted in 2 cases of our case series. Hemorrhagic retinal detachment were noted in only 1 case, where we are, after doing vitrectomy, we are stabilizing the posterior pole with the help of PFCL. Then removal of the subretinal blood was possible from the peripheral breaks, and then after completion of the vitrectomy and removal of the subretinal blood, we are doing a fluid exchange followed by laser and silicone injection. Post-vitrectomy retinal detachment seen in only 1 case. Persistent hypotony with choroidal detachment noted in 2 cases. Epiretinal membrane formation seen in only 1 case, and ERM post-op OCT showing the 3 months OCT showing their absence of ERM after but type and blue assisted ERM removal has been done. And this is sterile vitreitis with scleroidals with macular folds that is visible after clearing all the vitreous debris, and you can see the radial choroidal folds, macular folds around the disc. Retroprosthetic membrane was noted in only 1 case. Severely vascularized RPM with, we are doing partial lens membranectomy for this case. Severely vascularized RPM was noted with vitreous hemorrhage only 1 case. Endophthalmitis, that was culture negative with vitreous abscess noted in 1 case, where we are clearing the all vitreous exudate through the Boston keratopathy, and ultimately this case visible. Silicone removal with re-injection done in only 1 case. Post-op vascular RPM with vitreous hemorrhage noted, and in this case, final VCBA gain logMAR 1. Post-op RPM with final VCBA gain logMAR 1.4. Post-op hemorrhagic detachment and after silicone removal, vision gain to logMAR 1. Post-op sterile endophthalmitis, vision gain logMAR 1. But post-SOR, we again injected silicone oil to prevent hypertony, vision improvement, ultimately logMAR 1. This is another case. Was challenging factors were noted evaluated by Fisher's exact test, where difficulty in visualization seen in 8 out of 12 cases, difficulty in visualization in all steps of VR during p-value was really significant. Difficulty in vitreous base section noted in 6 out of 12 cases, p-value was statistically significant, and looking up to the Boral, it was a really impossible job in this case, in this eyes. Intraoperative recurrent hypotony was noted with choroidal formation in 1 case, but due to leakage around the cannula, as the patient was of ocular cicatricial pemphigoid patient. And intraoperative bleed was noted only 1 case, where during membranectomy we faced tolerance in bleeding around the vascular RPM. We did liberal cautery to prevent the hemorrhage. Postoperative chronic hypertony noted in 6 out of 12 cases. P-value was less than what was statistically significant. So like the permanent Kepro as essential value for visual restoration in patients with corneal blindness, many studies shows that both personal vitrectomy with Kepro, it is also a good option. We have intervened 12 times in 10 eyes with Vitreo retinal complications after 102 successful cases of permanent Kepro 1. In our study, most common indications were retinal detachment, 4 cases persistent hypotony and followed by retroprosthetic membrane. We evaluated challenging factors, and the statistical challenging factors were difficulty in visualization, difficulty in vitreous base excision, and postoperative chronic hypotony. Other factors were not significant. So we can conclude eyes with permanent Kepro 1 offer challenges for the vitreoretinal surgeons, and these vitreoretinal challenges can be managed successfully. Significant challenging factors identified in our study are difficulty in visualization, difficulty in vitreous base excision, and postoperative chronic hypotony. Thank you.
Now, out of the 12 cases you operated,
Pardon?
out of the 12 cases you operated, isn't
it? 12 interventions in 10
12
eyes.
interventions in 10 eyes, right?
Yes.
And 6 of them had vitreous hemorrhage immediately after your surgery, right?
Pardon?
6 of them had vitreous hemorrhage, no? After surgery, post-op.
6 of them, no. Post-op vitreous hemorrhage.
Only hypotony was the main.
Hypotony was persistent hypotony was the main postoperative complication.
Yes, complication. That was there in how many cases you said?
6 out of 12. 6 out of 12 cases.
So 6 of the 10 cases had persistent hypotony. And what was the visual acuity?
Visual acuity, it varied. It in a few cases, the Lockman 1.
Did they have ambulatory vision in spite of
Lockman 1, 6/60 incidence chart, yes.
In spite of the hypotony?
Yes, yes. They're maintaining the hypotony, but still they are having good vision. This is
now, out of 102 cases of permanent keratoprosthesis, you said 10 patients had these complications. Now, what was the indication for the primary surgery in these 10 cases which had the problems?
Now, I already mentioned in 4 cases retinal detachment, 2 primary retinal detachment recommendation, and 1 is hemorrhagic retinal detachment, 1 post-vitrectomy retinal detachment. 1 case was epiretinal membrane, 1 case was sterile vitreitis with macular folds, 1 case was culture negative endophthalmitis.
No,
yes.
No.
Kepro in all cases, mainly indication were failed graft, where the recurrent penetrating keratoplasty.
No, you not understood my question.
Yes.
We are running out of time. See, in a large number of patients who have undergone the primary surgery,
yes,
a very small percentage of patients have come back to you with. So I just wanted to know whether there is any correlation with the primary indication.
No, there is
no.
That was not no correlation, sir. Yes.
Okay, thank you very much. Now we move on to the next presentation by Dr. Nishikant Borse.
Thank